Hello, everybody. This is Signe Anderson. I am the Director of Nutrition Advocacy at the Tennessee Justice Center. You are joining us for today's webinar on public charge, how the public charge proposal can hurt Tennessee and how you can stop it. We are having a couple technical difficulties. I'm hoping I can open up the lines at the end for people to ask questions and comment. In the meantime, I will just go through the slides and hopefully I can hear from everyone by the end. So before I begin, I'm going to give you just a little, hopefully this is working. Bear with me. All right, so before we begin diving into the public charge webinar, I'm going to give you a little background on the Tennessee Justice Center. TJC works to ensure that all Tennesseans have access to affordable health coverage and access to the food they need through programs like SNAP when faced with hunger. In 2017, TJC assisted over 1,300 clients through individual casework. These cases covered choices, Medicare savings programs, and SNAP eligibility, just to mention a few. Our staff of advocates, lawyers, and volunteers provide trainings, continuing education, best practices, and technical assistance to individuals and organizations. And we advocate to improve access to healthcare and for improvements to the nutrition safety net. So that's a little bit about us. Now let's get into public charge. Here's the agenda for today's webinar. I'm going to give you a little bit of background on what public charge is. Then we'll dive into the impact of the proposed rule on Tennessee, specifically the harm to children and families, as well as the economic impact to the state. And then next we'll talk about messaging and submitting a comment. The deadline is December 10th. Put it on your calendar, and then we'll hopefully be able to take questions from the audience. All right, so public charge. Let's start off by offering some basic information on public charge and how it currently stands. It's important to note that nothing has changed yet with public charge and how it's enforced. Currently, public charge is a term used by the United States immigration officials to refer to a person who is likely to become primarily dependent on the government for subsistence. It is used to identify people who rely on the government for their main source of livelihood. All right, when is public charge assessed? Some immigrants permitted to public charge, the public charge test is assessed when an individual applies for permission to enter the United States or when an individual applies to become a lawful permanent resident. There is currently no public charge test when a lawful permanent resident applies for citizenship or green card status. Note that this is a very small fraction of the population. The public charge test does not apply to undocumented immigrants as they are not eligible for benefits and are not receiving them. So who is exempt from public charge? Some immigrants permitted to enter or remain in the U.S. for humanitarian reasons are exempt from public charge, including all of those listed above. So refugees and asylees, survivors of trafficking and other serious crimes, self-petitioners under the Violence Against Women's Act, special immigrant juveniles, and people applying for temporary protected status. Again, undocumented people cannot become LPRs without obtaining status or some pathway to citizenship. So most have no way to obtain status, and if they do obtain a pathway to status, they generally have to leave the country for either 3 to 10 years before getting on the pathway to citizenship. So public charge, the current benefits considered. Currently, there are 2 public benefits that are considered in the public charge test. Cash assistance for income maintenance, which is SSI, includes SSI, and TANF, which is the temporary assistance for needy families. And the second one is institutionalization for long-term care at the government's expense. One change to note that in January 2018, the State Department did revise the public charge provision of the Foreign Affairs Manual, which means that now consular consular officials who process visas abroad may now consider a sponsor's use of public benefits and determine on their end if they receive a visa or not. So note that this only affects decisions made by consular officials abroad. So moving along, whether a person is likely to become a public charge is based on multiple factors relevant to their ability to support themselves and any dependents. Policy emerged in the 90s that public charge should be based on the totality of circumstances. In 1996, a Legal Immigration Reform and Immigrant Responsibility Act codified what circumstances should be considered. So all of these listed here are considered age, health, financial status, family status, and education and skills. And then if those first five are not covered, then you can use your affidavit of support. The public charge test looks at much more than just the receipt of benefits. It looks at the totality of circumstances, which includes benefits plus the factors listed above. If there are issues with the first five, then the government looks to the individual's affidavit of support, which is a letter of support from a sponsor who will financially back you if necessary. Another thing to note that in 1999, the government issued guidance that only cash-based income assistance, temporary assistance for the TANF and SSI, which I mentioned earlier, would be considered, and those benefits would have to account for over 50% of an immigrant's income for her to count as dependent on public benefits. Now I'm going to dive into the proposed regulation. So we just covered how the proposed rule currently is, and now I'm going to talk about proposed regulations. So the current public charge definition is so narrow that the government almost never rejects applications on those grounds. The administration's proposed new definition, on the other hand, would require a more expansive inventory of an immigrant's history and economic prospects. It would give enormous discretion to the U.S. Citizenship and Immigration Services officers to reject an immigrant's application for admission or for a green card because the immigrant doesn't make enough money to support a family or doesn't have the resources to provide health care for pre-existing conditions. So let's see here. Again, there we go. So the proposed regulations, there are three main buckets to focus on when looking at the proposed regulations. The first is the new rule, broadens the definition of who a public charge is. It moves the definition from someone who relies on the government for their main source of support and changes it to someone who participates in a health, nutrition, or housing benefit to support them in the work that may be low-wage work. Secondly, more factors are considered. If you are low income, if your English proficiency is low, and if you have a medical condition, this can all be weighed against you in the proposed public charge test. The third bucket to look at is that the proposed rule adds additional benefits to the test. So now Medicaid, SNAP, housing assistance, and Medicare Part D low-income subsidy is now included along with the cash assistance and long-term institutional care. This now creates a lot of ways that immigrants can fail the public charge test. So I wanted to focus just a little more closely. I think it's important to highlight the 4 additional types of benefits that would be included if the proposed rule is passed. Again, there was specific guidance set by the government in the 90s to exclude these benefits from being factored into the public charge test. If this were to pass, then that guidance goes away, and it would make most Medicare would now be included for except for emergency care. SNAP, the Supplemental Nutrition Assistance Program, formerly known as food stamps, would now be included if this passes. Housing assistance and Medicare Part D low-income subsidy, which makes prescription drugs affordable to seniors. This would also be included in the test. All of these added benefits discriminate against those who are struggling to make it. It targets children and older adults. So this is really, truly a heartless, short-sighted proposal that we should all be thinking about when we put together our comments. Note that this test is forward-looking, so benefits that you've used in the past are not factored. No immigrant currently using benefits would be penalized for that in the future. The rule would not be retroactive. Benefits that are received before the proposed rule is finalized that are currently excluded from the public charge test, that being Medicaid and SNAP, for example, would not be included in the public charge determination until the rule is finalized. All right, now let's look at the heavily weighed factors. The proposed rule adds more weight to certain factors. For example, a lack of a job or a low-paying job will make it harder for you to pass the test. The main positive factor that the government will look at is your income. If you have resources over 250% of the federal poverty level, then your chances of passing the public charge test are improved. And here are just a few points to remember. These important statutory factors cannot be changed by regulation. Public charge is assessed when a person applies to enter the U.S. Or to become a permanent resident. The balance of factors must be considered, and negative factors can be outweighed by positives. Some categories of immigrants are exempt. That was the slide we looked at earlier. The other thing that I want everyone to remember is to submit your comment by December 10th. All right, now let's talk about the impact on Tennessee. It's important to avoid harmful stereotypes that all immigrants are receiving benefits. Most immigrants directly subject to this rule change are ineligible for any public programs in Tennessee. It's really important to look at this from various different angles. For example, 1 in 4 children in the U.S. have at least one immigrant parent, and if those children are citizens, then they may qualify for benefits, and they are entitled to as U.S. citizens. Because of the prevalence of mixed status households in our immigration system, historically we're working to prioritize families. This proposal, among other policies encouraging family separation, will only work to cause fear and confusion in future separate families. So again, this will harm children and families across Tennessee, as well as across the country. The other thing I want to really focus on is the chilling effect. The proposed rule itself is a problem, and we should do our part to oppose it. But maybe the most detrimental and immediate effect that the proposed rule has had is that it has struck fear throughout the country and has led to significant decreases in participation to these programs that aren't even yet, and hopefully will not be a part of the rule. But people are starting to pull out of these programs. It's important to note that earlier versions of the proposal were leaked to Vox and to the Washington Post, which in turn stoked fear in Tennessee and across the country. Just look at some of the points listed in the slide here. Tennessee, there have been drops in Medicaid and SNAP enrollment, in evidence of children being scared to eat school meals for fear of retribution. Nationally, families are disenrolling from programs that aren't included in the final rule due to fear and confusion. WIC participants continue to disenroll. And disenrollment, in turn, affects the entire state. It affects the country. People become sicker, poorer, hungrier because of the domino effect of this, of everything surrounding public charge. Agencies in at least 18 states say they've seen drops of up to 20% in enrollment in WIC, and they attribute the change largely to fears about the immigration policy. So this is the chilling effect, and this is where the problems are really having a major impact. So if you aren't moved by the human impact, the Tennessee economic impact is just as significant and will be detrimental as well. It's difficult to estimate the exact economic impact of disenrollment because we're not sure how many families will disenroll, but the most conservative estimates are based on a 15% disenrollment. So with that in mind, there will be $62 million lost in federal funds to the state. And as a result of that, the loss of economic ripple effect would be close to 119 million, with a job loss of 811. And this is on the low end. The disenrollment could be as high as 35%, which could lead to 278 million in economic loss across the state. So that's also something to keep in mind. Another thing I wanted to include is this information. The following points are actually pulled directly from the proposed rule. Each of these factors, I think, merit comment and are reasons enough to oppose the rule. So if you Google the rule itself and do page 51,270, it will give you this. So the projection is that if this rule is passed, there will be worse health outcomes, including a prevalence of obesity and malnutrition, especially for pregnant or breastfeeding women, infants, or children, and a reduced prescription adherence. They are predicting an increased emergency room visits and emergent care, which could be a result of people delaying treatment or avoiding treatment. They predict increased prevalence of communicable diseases, including among members of the U.S. citizen population who are not vaccinated. They also predict increases in uncompensated care in which a treatment or service is not paid for by insurer or patient, increased rates of poverty and education, reduced productivity and educational attainment. So this alone, I think, merits reason to comment and oppose the public charge rule. So I'm going to move on to messaging and submitting comments and give a little bit of guidance on what to do there. So the top line message, it really is that this is a destructive regulation that is part of the larger push to separate immigrant families. It also comes across that it projects that only the wealthy need to apply. It puts millions of people at risk, immigrant and non-immigrants alike. I also wanted to give folks just a view of the timeline and how it all has kind of shaped out. So in January 2017, this is when the leaked executive order came out, when we first got word of public charge in the proposed rule. And there was a lot of misinformation in that first leaked executive order, which has resulted in the chilling effect and the confusion and people pulling out of the programs. So then in January 2018, I mentioned this earlier, there were changes made to the Foreign Affairs Manual that affects people, the consular offices abroad. On October 6th of this year, the public rule was dropped, so opportunity for public comment opened on October 6th, giving all of us 60 days to comment, which means December 10th is when comments are due. I also recommend that folks not wait until December 10th. It's a good idea to start your comments now and comment yourself, comment on behalf of your organization, encourage your friends and other organizations to comment, because DHS must review all comments. The Department of Homeland Service must go through all the comments and take them all into account. And then once they've done that, then the final rule will be published. And then again, there is some time that passes before it officially goes into action. Agencies are required to provide 60 days for public comments. All right, so submitting a comment, one thing I wanted to mention here, I put this on a slide all by itself just so folks know that submitting a comment is not lobbying. Some people have expressed concern about submitting the comment. It's not lobbying, so if you're restricted under lobbying rules, this doesn't apply. You can comment on public charge. And here's a little more guidance. So with this information in hand, you're thinking about putting pen to paper or more likely fingers to keyboards. Here is some information that might be helpful as you put together your comments. So the minimum word is 250, maximum of roughly 2,500 words. Make sure that you're offering unique comments in your own words. These will be counted individually. They're asking that 30% of the content be original in order for it to be counted. But that's being said, even try your best to be as unique in your comments as possible. If you are a concerned individual, explain why. If you're commenting on behalf of your organization, you can speak to what your organization does and why you are concerned about this. Highlight any relevant data and research that you might have. If you have any questions about this, feel free to reach out to us at TJC. We're happy to find data for you. And use our comment guidance to help draft your comments. And on the next slide, I'll share the link and a few more resources. Before I get into the link and the resources, here's just a little more guidance. This is one way to break it out, breaking it out by different sections, talking just basic introduction, talking about your authority and experience. You can comment in a personal capacity as well as a professional capacity, and then ending with a statement of concern. So I'll leave this up for just 10 seconds for people to take a closer look. All right, so submission and public charge resources. So here, the top link is the link for the federal comment portal. There are also several comment microsites. There are several organizations like FRAC, CLASP, Feeding America that have comment sites on their websites that ultimately feed into the federal comment portal. These organizations also have sector-specific comment templates. If you have not been to the Protecting Immigrant Families website, check it out. There are a lot of resources there. It also breaks down, like I said, breaks down your comment specific to your sector. So if you're not sure what angle you're going to take from your line of work, chances are it's listed in the resources that are out there with some interesting talking points that you can include. Lastly, if you need help or you want us to review your comments, please feel free to email us. Email Anna Walton. This is her email address. And again, I'll leave this up for a few seconds. We can also share this information following the webinar. All right, and any other questions that folks have? I didn't notice that anyone submitted anything in the questions chat box. I'll hang on the line for a few more minutes. But if you have any questions following today's webinar, feel free to reach out to me. My email address is listed there, sanderson@tnjustice.org, or feel free to give me a call.